Yes, I'm Mary Bednar, the Director of Emergency Services here at Christus St. Vincent.
And how has the curtains benefited your department and with the patients and staff?
Well, there have been quite a few benefits from this. First of all is the feedback that we've gotten from patients. They see these scenes and they're continuously remarking about how beautiful they are, how it makes them feel at ease, makes them feel at peace, and it gives them something to look at rather than just the four walls of the treatment room. So the feedback has been tremendously positive across the board. The other qualities that we really like about these curtains are the antimicrobial benefits of that and the stain guard associated with it. Very easy to clean, very easy to wipe down, and it really provides a benefit in a busy emergency department where there's continuous turnover. We're always concerned about infection control. So these, I think, have really made a huge difference. We're not taking them down frequently, cleaning them. They've stayed very nice. These have been up for quite some time and they still look as good as when they were first hung.
It's like a quiet distraction?
It really is a quiet distraction, and it's almost like this more therapeutic milieu for our patients, because previously we just had plain beige curtains in the department and the four walls and ceiling of a treatment room. And now I can't tell you how many staff members have said, before we got these, we didn't know what we were missing, and now that we got them, they're continuously receiving great feedback from patients on these curtains, and the patients are saying, this really is one of the nicest emergency departments that they've seen because of the scenery that's on these. And we have several different scenes in different rooms, so everyone who comes through, if we have folks coming back, they may not be in the same room with the same scene, so they're all beautiful. But like I said, the feedback has been really good. But prior to us getting the patients, I can tell you a funny little story with our staff. I was talking up these curtains and saying, we're getting them, they're going to be great, they're going to be wonderful. And a couple of our docs and a couple of our staff members were going, oh, come on, it's a curtain. And then once all the curtains were hung, they came back and said, okay, you were right, it's really made a difference. We're hearing great things from patients, and look how beautiful they are when you're going into the treatment rooms. So that threefold thing, the patient satisfaction piece of it, and just providing that more relaxing environment for patients, that little bit of distraction while you're in a room awaiting your care. The antimicrobial properties, really, really important when you have such high turnover. And then the stain guard component of it, just to be able to wipe it down if you happen to get a splash or some betadine or something like that on there, to just clean it off. It's made a huge difference, and it saves time and room turnover as well.